So when a patient comes in for Botox and they've never had it before, I typically like to sit down with them and talk about what it is that's bothering them. We usually look in the mirror together and they'll show me an area that they feel like has lines, or area on their forehead, around their eyes, or in between the brow that they say that makes them look angry or they're not happy with. At that point, we'll talk about what's involved with how many units, which is a little increment of how much we inject, how much they might need, what that would cost, and how the treatment would go as far as pros and cons, how long it will last, etc. So every injector has the goal in mind that we do not want you to have a bruise. However, some people will come in and it's been New Year's Eve a couple nights before and they've had a lot of alcohol, or if you take things like herbs, vitamins, Aleve, aspirin, things like that, you may have a higher risk of bruising because it tends to thin your blood. It's so important to let us know as an injector what you've had, even if you don't think it might matter, because all of those things together can play a role in whether you make a bruise. But in the long run, our goal is that you walk away and you don't have any. That's a good question, because that's something I asked as an injector years ago, and the dermatologist I started with told me that it had been studied for many, many years prior to that and actually had FDA approval. It basically goes exactly where we put it. If it migrates at all, it can be just a tiny bit, like a half a centimeter. And you have to remember, in cosmetics, in the world we live in and work in, we use a tiny amount of Botox versus other specialties that use a lot. So it's been used quite a bit, and they have specific guidelines that we follow. You have to understand anatomy of the patient as well. But I think the way that we do it as trained injectors and physicians, and that we all have been trained to know exactly how to use it in a safe way. Cannulas, I would like to describe them as kind of a blunt-ended needle. They are used to, instead of a needle, to minimize bruising in certain areas of the face. It is an advanced technique that we all use here at Kirby Plastic Surgery Kalos Med Spa, but it's not something that everybody does, and not everybody is good at it. So it's important to ask if the person's used the cannula before, where you're going to have that treated, and the pros and cons or risks that go with that. So I've had that question a lot, and basically the way I answer that is, if you have lines in your forehead or wherever you're having treated at rest, those lines can still be there after treatment. Remember, Botox is there to stop the action of the muscles, not necessarily to get rid of the surface imperfections, which I believe will get better and better with time, but that can take several treatments. Absolutely. So a lot of times people come in and they talk about this fold that runs from the nose to the mouth called the nasolabial fold. It can get heavy as our cheek descends. So in the old days, what we used to do is just fill this area with filler to help soften that and bring that up. However, in the last few years, the newer way to handle that, typically based on the patient, is looking at this cheek area to see if by lifting the cheek with some filler, or even the mid-cheek area, will take the heaviness off. So a lot of times we end up treating the cheeks when the patient thought that this area was going to need it, and they're 10 times happier with the result.